Hi, good morning. This is Andrew Lalo, Shuti President. Hey, hope you have a really wonderful weekend. But on the other hand, today, thank you very much for joining us for the upcoming webinar. This is so wonderful. I think today is a topic. This is kind of really interesting for many of you who never realized nerve damage or nerve disorder due to diabetic is there. And so today I purposely put this webinar together because quite a few of my clients keep saying that, hey, my leg is hurt, my toe is hurt, I have difficult moving around. So a lot of times they didn't realize this can be due to their diabetic high blood sugar affect that. Now, so today's lecture will just give you some idea. This can occur to you, so you have to watch out for that, and that will be good. So anyway, this is we will start now, and then we'll go from there. Okay, good. So today our topic will talk about what involved is this nerve and muscles issues, which you might never heard of. You mean if I diabetic, I also have problem with nerves problem. You're absolutely correct. And a lot of people don't realize that can be truly occur. So that's why today's lecture can be a very enlightening one. And I have quite a few of my clients right now actually come over and tell me that I have all these pain, what it is. So actually end up I refer them to their own doctors, which they find out, oh, the diabetes actually could affect them. Uh, amyotrophy is the key issue of diabetic, which potentially affect all the pains. Could be the back, could be a knee, could be a leg. So all that will occur. So let's start talking about that today and get you some information like yourself to understand what that is. Now, basically, as I said, this is mainly for type 2 diabetic. They potential with that. So what is diabetic amyotrophy? What's kind of symptom? What's the cause? For a risk factor? And we need to manage that. How do you manage that? What is the strategy? How to avoid? Like, for example, can food avoid this? And so we give you a healthy alternative to decrease your blood sugar, decrease the problem that you might have, and how the sugar to help you. And that's today's webinar. Now, notice today a lot of people that in my list, I don't see them before. So I would like to catch up with them to basically understand, wow, okay, what is really so-called, how do you form from non-diabetic to diabetic? So usually everybody go through 4 stages. And the first stage is that the LDL cholesterol goes up. Now, when the LDL cholesterol goes up, it damages the B cell coming out from the pancreas. The B cells will take sugar to the cells. So when damage the B cells, the more B cell come, it doesn't work. So the blood sugar will continue get more and more circulate around in the blood vessels. The LDL cholesterol and blood sugar mixed together, your problem start because it will form a lot of plaques throughout the vessel wall. Now, with that, we'll move very quickly to stage 2 because all these vessel walls get narrow and less space. So the blood pressure goes up. Usually it goes up, to 130, 140, 150, and so on and so on. But you will never feel anything at that time. You have no issue, no pain. You do the same old lifestyle. So without no change of different lifestyle, diet and exercise, whatever, you very quickly move to stage 3. And the stage 3, now you become a pre-diabetic. Now, pre-diabetic, how every doctor will measure the same old thing. They measure your hemoglobin and they measure the percent of sugar attached to this hemoglobin. If you are 5.7, you are a normal person. Lower up above 5.7 to 6.4, you are now pre-diabetic. Now, doctor will say to you, say, hey, you are pre-diabetic now. You need to change your lifestyle. You have to control your diet input, less carb, and exercise, lower your weight, and measure your blood sugar. Now, because you have no sign and symptom, and the doctor will not give you medication because you are not diabetic yet. So net result, the doctor said, change your lifestyle. Now, that's where we come in. You can use low sugar tea, drinking of tea, 6 to 8 cups a day, you can actually lower your blood sugar, cholesterol, and blood pressure, maybe the range of about 6.4 and running back to about 5.7 or lower. So this is very important. Matter of fact, you can drink that even when you have stage 1 with LDL cholesterol goes up. You can already start drinking, so you never get down to stage 3. Now, but you don't do anything, result of problem is come. You will move to stage 4, and that will become your A1C will go beyond 6.4 and continue move up. Then you become an actual confirmed diabetes. Now, once you become a diabetic, guess what? You can't go back. You continue to be diabetes, and that's why the problem. Well, you might ask, why low sugar tea? Now, low sugar is not a drug. It's a food only. There are 2 types of food inside. The guava leaf bits, which delay absorption of sugar into the blood vessels. And then your bitter melon, which increase the insulin sensitivity, so it take back the sugar to the cell. Excess sugar and cholesterol and salt, they'll dump it off through the urine. And that result, because it dump out urine, so you now get sugar going down, your cholesterol going down, and your blood pressure going down. Your 3 high will go down, plus it will detox. That's why low sugar tea, it will be so good, work for so many of the clients. Can see themselves from high A1C drop down to very from high 10 plus and drop down to below 6 and moving to 5.7. Now, we don't just tell you to drink tea. We also ask you to, besides drinking the tea 6 to 8 cups a day, plus you have to do your low carb diet, and that's very important to control, plus your low fat diet. So diet control is very important. And we have 340 plus lecture teach you all anything about how to diet, and you have to do exercise, and we have lots of that program too. The exercise for 8 to 10 steps per day. And then you also need to have weight control. You got to lower your BMI from 30 all the way to 23. Now, I know it will take work, absolutely, and it will take time to get you to all these goals. But importantly is your health will definitely improve. Plus, you would listen to our weekly webinar, and you know you have been listening to this all this time for free. We give you the webinar. There's 340 plus webinar you can actually pick on from Facebook. Plus, every week we'll give you a webinar for free. Plus, your daily tracking with food and diet and so forth. So this is what we basically provide you for all free. But that result, you will be healthy and good health. And on top of that, you will see your grandchildren and so forth. You won't have big medical bill. That is our objective. And I think if I do that, I fulfill my mission. Now, so that result, what is the so-called type 2 diabetic? Now, a lot of people right today, a lot of customer here are new, so they might not know. But anyway, in the way how we measure if you are really type 2 diabetic, usually your blood sugar is higher than 130 milligram per dil or 7.2 millimole per liter. And this is when you have no food for 8 hours and your blood sugar continue to be this high, 7.2 millimole per liter, even you haven't eaten. Now, then also after after meal, your blood sugar level is go up to 180 milligram per dil, 10 millimole per liter, even measure after 2 hours after eating. So that is a good indicator you are now already getting to type 2 diabetic. So hyperglycemia, which means the higher blood sugar, high blood sugar for people who are type 2 diabetic. But some of the people might not be diabetes, but the blood sugar is also very high. So these are usually people of their polycystic disease or Cushing syndrome. So these are people who get high blood sugar, but they might be not diabetes. So very important. If you why a doctor will get you to do fasting blood sugar, and then also look at your blood sugar after a meal 2 hours later. So if your blood sugar definitely go up over 130 milligram per dil, you need to really look at it and say, hey, maybe I really become diabetic. Now, more important, every single doctor will probably measure the A1C. A1C is the really worldwide standard to measure your blood sugar level. And what it does is give you a 3 to 6 month blood sugar average, okay? So you know if you have 5.7 or lower, you're a normal person, or estimated average glucose is 170 milligram per day or 6.5 millimoles per liter. Now, if you are pre-diabetic, as I mentioned, it's 5.7 to 6.4. The range is very small. Amount of sugar percentage attached to this hemoglobin, 5.7, 6.4%. So net result, you know that will be something that you need to look at if you are pre-diabetic. Now, if you're pre-diabetic, you got to work on things like lower your blood sugar by diet control, drink low sugar tea, exercise, weight control, lower your BMI to 23. Now, if you do all that, your A1C definitely will drop down. If you drop 10% pound, you will actually low 1 A1C, 1 percent. So in other words, you are maybe 8%, you drop 10% of your weight, you go down to 7%, or whatever number you are at that time. So that is really important you have to work on. And certainly, if you are diabetic, is your A1C is over 6.4, and then as long after that, it will just continue goes up. And especially a lot of people, reason why they continue to go up is they have a lot of insulin resistance. In other words, meaning the B cell keep coming out, it continue to get damaged, and that result the B cell doesn't work anymore. So you have tremendous insulin resistance, and end up you might even have to have insulin for yourself to get to burn up your sugar. Now, really the prevalent type 2 diabetic in the world, actually right now, is growing so fast. It's estimated 830 million people globally in 2022 have diabetes already. And then 95% of these people are type 2 diabetic. It's a very fast growing disease, okay? And the cause of death is about 1.6 million people in 2021. And usually this 47% of this happen to age 70. You know, you're over 70, you have diabetes, many of these people actually die because they either don't take care of themselves real well or either to die or whatever, but they will die. And that's why this is so important. Now, also 530,000 people actually develop kidney disease and they die. And because this diabetic, reason is the sugar continue to damage the blood vessel, and that result the kidney vessel no longer filtrate, and you end up to dialysis. So that is not a good place to go. You don't want to go there. And plus, many people went to blindness because of the fact that the sugar tend to block off all the vessels, even the eye vessel. If you go see a doctor, see a diabetic eye, they see all the vessels are going everywhere because they block and they go another, so it end up damage the eye, or they have to go kidney disease, the dialysis, the amputation. The worse that they get to heart, it will get heart attack and die. And 3% increase mortality rate. The mortality is increasing 3% per year. That's a lot of people. And cardiovascular related high blood sugar level, cardiovascular death is about 20%. So really, at the end of the day, it is a really disease that you have to continue to watch. And the death rate is high, medical expenses is high. So more so, you have to really monitor yourself, have to watch. Now, what is the early sign of type 2 diabetic? Usually they increase of thirst. They get thirsty very fast. They keep drinking water, but didn't help to release that. And dry skin. Now, pre-diabetic, that is also a very early sign. If they are pre-diabetic, they are very early, and the leg gets very dry and a lot of dry skin. And then after, and also the type 2 diabetic will become blurred vision. You have fatigue, you get tired very quickly. And also you have tingling feeling at the hand and feet because the nerve damage, right? So you're going to have tingling hand, feeling, and feet. And also you're going to have itchy and yeast infection. A lot of the people type 2 diabetic, that yeast infection, the vaginal yeast infection is very, very itchy. It's not good. And also many of the diabetic type 2 diabetic patients, they tend to get hungry very fast, but even eat a lot didn't help them relieve the hungriness, and they have numbness, Also frequent urination, that's very common. And plus, the worst thing is the sore, like a blister, the fit, and it is seeing that is hurt or whatever the blister, it doesn't get well. It get very, very, and the sore will become bigger and bigger. And you gotta take good care of that, because if you don't take care, that place become gangrene, you gotta chop it off. Wow, that would be terrible, right? So all these are early sign of type 2 diabetic, which if you you gotta get to the doctor, gonna teach you, have to help you to how to control your blood sugar to get your symptom to lower. So all these are very important signs that you have to watch at. Now, as I mentioned, if you're type 2 diabetic, you're going to end up with a lot of complications coming along. Why? Because the blood goes through your vessels at the back. You know what? The blood can't go through, or it'll block because of the plaques that forming. And that affect your brain. And if that's the case, then you're going to have, like, for example, potential stroke or loss of consciousness or memory. Lost memory is a very common one. I don't know if you have any relative. Keep asking the same question 5, 10 minutes, actually 20 times. Like, for example, have you had dinner yet? And the relative got very frustrated. Mom, you just asked me 10, 20 times already. But the problem is all the short-term memory, they can't remember. So they just being kind, ask you, have you had dinner yet? But she doesn't know, okay? And it happened to my mother-in-law as the same thing. But the children is very frustrated. Hey, mom doesn't just keep asking the same old question. Well, the reason is the blood sugar just clog up the brain and back. You know what? They can't remember. Now, also glaucoma, and it's really sad because you see the eye become blurred and cannot see, and so all that has to right away get to the doctor, because it get too worse, you can't save the eye. Or your pancreas doesn't work anymore, so you need injection of insulin. The worst that you got heart disease, because what happened is remember all the plaques that you formed for years, it gonna start clogging out what? Your coronary artery. And that clog the coronary artery, wow, you have a big issue, because once the artery clogs somewhere, the heart is damaged and you will die, basically. Your heart disease, a heart attack. Now, also, many of these people have high blood pressure, and the vessel become damaged, hardened, and it will cause you to stroke. And also, I mentioned nerve damage. Now, a lot of people don't realize nerve, because the same thing is a blood vessel going through, go to the nerve. The nerve are no longer have the nutrients. Guess what? The nerve would start damaged and cannot have the feel. And so net result, you have injury, you don't know why didn't heal. So net result, you're gonna end up with a gangrene, you have to amputate, or you have a kidney that is block all the filtration, it's not doing well. Your kidney is gonna start failing, you have to dialyze. Hey, I used to be a dialysis nurse. You don't want to be there every 3 times a week. You have to go to dialysis center to dialyze, and it will be very, very sad. So don't go into the road. So control your blood sugar. And also your pregnancy, your complication. Many people are pregnant and they end up with gestation diabetes down the road. So if you're pregnant, you had it before, you got to continue to watch your blood sugar. Many people also have sexual dysfunction because they can't feeling anymore. So because of nerve damage. So all these are type 2 diabetes complication. Now, this is something that it will cost you a lot of medication, a lot of cost of medical costs, impact your health. So you gotta really take good care. That's why we give you this information, so you will now alert, and then you trying to prevent all these things can happen to you. Now, so there's a risk factor for type 2 diabetes. So you're obese, for example, I'm overweight, my BMI is like 32, 33, 34, 35. And also your family history, all your children, not your children, your grandparents, your dad, your uncle, they have diabetes, most likely you have your potential diabetes. So you got to watch. And you're also 45 and older. When you get older, you have also a chance to also get diabetes because the pancreas doesn't work that well. And also your diet also not really, in the best practice. So that will just accumulate, go on. And high cholesterol, high blood pressure, that is another risk factor you will have. So a lot of people, if they're high cholesterol, especially LDL cholesterol, and then your blood pressure also go up. Now you have a high risk of type 2 diabetes. A lot of people don't realize it's all sleep apnea. Matter of fact, I have a customer just recently came in to see me and said, hey, I saw him just keep dozing off in the day now. This is at 4 o'clock. He's dozing off. The reason is at nighttime, he doesn't sleep that well because what happens is the tongue keep covering his trachea. And then that result, he could not breathe, but he doesn't know he's sleeping, right? So he will have like 1 minute doesn't breathe and suddenly wake up. And so he sleeping is no good. It's all effective. It's called sleep apnea. So you really got to get the CPAP machine to help you to breathe. And that is something that you might need to have. So very important. Sleep apnea can really affect your actual create a situation you can be also related to type 2 diabetic. Now, you also may be a sedated person. I don't move. I watch TV a lot. I just eat a lot. And especially a lot of people, engineering, computer science people, they tend to sit in the office all day long. They don't move. And if they don't move, they don't exercise, that result, they also accumulate a lot of weight and not circulating your body. So all these are potential risk factor for your type 2 diabetes. And that's something that you really need to work on it, okay? Okay, so what is diabetic amyotrophy? Now, this is a rare diabetic nerve damage in diabetes, most likely affect type 2 diabetes. Commonly, this is for older people, meaning 60 and up. And if the reason is because along the way, the diabetes that damage all the nerve in the thigh, leg, hip, and buttocks. So your back is really sore, your hips sore, your legs sore. Now all that is a good early sign. Now you have diabetic myopathy, and diabetic myopathy is referred to like the different type, proximal neuropathy, and so forth and so forth. So really, at the end of the day, when you have that kind of symptom, you really need to start asking to see a doctor to understand. And the symptoms usually are from severe pain in the thigh, hip, buttocks. Those are more common symptoms. And plus, this pain is usually sharp, burning, and aching, and usually also affect one more side, one more area. It's not only one place. It's a couple places. So the muscle will eventually become weak and become wasting. In other words, you don't move anymore. It will be atrophic, meaning the muscles are shrinking too. And at the end of the day, if you continue, don't do anything, you end up with trouble standing up or climbing stairs. So really, at the end of the day, if you got this symptom of suddenly this high pain coming in your thigh, hip, buttocks, and the sharp burning, you gotta really see your doctor to help you out as soon as you can. Because as time goes on, you don't treat it. The worst thing is the muscle become atrophic. In other words, it shrink, and you will not have you have difficult to actually standing up as weak. Okay, now the cause of that is because your nerve is blocked, and then it become inflamed, and it become reduced blood flow in those area, and really all that related to diabetic related metabolic change. Now, the really common risk factors are usually because you're type 2 diabetes. You gotta be a really type 2 diabetic. This is the most common people will get this kind of issue or sign and symptom. And then because the blood going through, you have all the sugar at the back, it block those areas, poor blood flow control. And you usually older age, you're typically over 50 and up, okay? And the older you got, the more chances you get that possibility. Usually they are male, more frequent affected male than female, and you have a long-term diabetes already you've been over 10 years of diabetic already or more, and you also before you actually have all these symptoms, you tend to have a rapid weight loss. You tend to lose a lot of weight, but that you thought it was good. But the problem is, it's not, because the nerve are damaged and you actually feel many pain. And also other diabetic complications come in, like for example, affect kidney, your eye, and so forth. Wow, that would be terrible, right? And so you have a lot of vascular issue that will come in because of the fact that the blood flow to those needed area are not getting blood feeded into those, and the nerve start getting damaged, inflamed, and so net result you have all kind of issue coming. So really, you got in other words, you got to really control your sugar. Make sure that your blood sugar are good and doesn't block quite a few of the vessels and eventually damage your nerve. So the issue is that simple. Okay. Okay, now also other condition, when you look at it, your spine could have also have pain, and also your muscles that damage, so lead to pain, swell in the thigh area, and that is really important because you feel the muscles, a real tight swell up and pain. And also we get tingling feeling, burning, pain in the thigh. That is very common. Now, the doctor will really need to check you. So because you got to go see the doctor if you have all these symptoms now. So they usually they check a blood test, make sure how severe your sugar is. Maybe your sugar is extremely high. They may even do a spinal tap, testing spinal fluid to see any sign inflation. Plus, they might do an image test as like X-ray, CT scan, MRI, and they also do a nerve test. So they use electromyography to check the nerve health. So they also taking your foot a little bit and see, do you feel this? Do you feel that? So all that will be basically on checking on diagnosis to see whether you have that problem. So now you now aware this, okay, now you go to a doctor, but how you prevent of this? Now that is something that really important because you really don't want to get into that stage, right? So you really key thing is you got to control your blood sugar, not let them out of control. Now you got to keep it under 120 milligram per deal, or that is important, okay? So you got to get a regular A1C test all the time because doctor, when you see you, they will do an A1C test. So you will have to have your blood sugar around 180 to 130 milligram per day lower, or 4.4 to 7.2 millimole per liter before meal. This is before meal. A lot of time what they will do is they do a 8-hour test, fasting test. So without eating, you take a test. So your blood sugar should be 80 to 130 milligram per day. That is important. And if you eat 2 hours eating, you have to be less than 180 milligram per deal or 10 millimole per liter 2 hours after the meal. That's very important. So you have to keep your blood pressure in, and also your blood pressure inside the target range. And the blood pressure should be under 130. Nowadays, they ask you under 120 for your systolic blood pressure. Diastolic must be under 80. So 120 to over 80 is the target you must have. So you got to control your blood sugar and also control your blood pressure. Now, but to do that, another prevention you have to do is exercise. Now, that is something that a lot of people I talk to, they don't tend to do the exercise. You have to basically walk, basically 1 whole hour, 10,000 steps. You must say, wow, that's too hard. No problem. Start with 3,000 and then move up to 5,000 and then 7,500. Eventually, 10,000 within that 1 hour. That is the key. You can go to shopping mall, anywhere you go. Or you say, I don't have a shopping mall nearby. Okay, get a Step Master. Get a barbell. Do 1 pound barbell. Do this. And while you're walking on the Step Master, do this. Have 1 hour. You can start out with 20 minutes and then 30 minutes and then 45 minutes and then 1 hour. Very simple. This Step Master costs you maybe $50 and that 1 pound barbell is very cheap. So do that. So you got to start gentle, low exercise, prevent, you have to get some strain exercise. That's why the barbell is helping you to do that, and you have to continue to move. Then basically focus on straining your lower body, and you combat your weakness and muscle loss. So, the step master is very important because you have to press down, press up. That will give you strength. Your body will actually have to force the muscle going down. So it will give you muscle tone. So you got to keep doing that. So net result, you will not going to be not moving at all. And especially like older, you have to continue to engage this kind of exercise to enhance the nerve health. Because when you press down, up and down, you have to press the press muscle or walk the same thing. So you always maintain good blood flow, and that's the key of exercise. Now, we talk about weight loss. Now, that is another one. It's a very challenging, including challenging me, because my weight sometimes just go to travel and add another 7 pounds, coming back down another 7 pounds. It's very hard. I have to now, besides eating less, meaning I have the soup diet, exercise, and also eating mainly vegetable. I eat a tremendous salads, but no more meat, no more nothing, just salad. And now my weight will start coming down, 3 pounds, 4 pounds coming down, go back to my original weight. Wow, that's really hard. But you got to have your BMI between 18.5 to 24.9. So if you are man in Asian area, you got to have 23 BMI. Really, at the end of the day, that's your target. And you have to, if you're over 30, you have to get some help. Maybe get from your healthcare provider or exercise place you do. You have to lower this weight. Now, a lot of people, after they go to a weight counseling, they tend to be able to do that because they have diet control, food program to eat. Plus, you have to stay hydrated. That's why we make low sugar tea. You drink 2 liters a day, because if you have 2 liters a day, you know what? You can dilute your blood, so the blood sugar less, plus you need enough volume to excrete all your excess sugar, cholesterol, and salt out of the body, so your 3 high will go down. So you got to stay hydrated. Each day, somebody drink 3 liters of water. A lot of people don't drink enough. They can't excrete. So all the sugar continue to go around. No good. So stay hydrated. So you have to weight yourself daily, regularly. Some people weight 2 times, 2-3 times a week. That's okay, but you gotta have that track and write it down, and that's important so you can able to track. Now, the food you got is so important, because food really can prevent your problem. And if your blood sugar are continue to be high, you gotta have the food control. You have to find more refined carbohydrate, and people actually basically how to do that. You gotta cut off your white bread, your pizza, your pasta, cracker, other snack, like a lot of people eat chips. Oh, that would be terrible. So if you can able to decrease that, you actually get less chances to get nerve pain, and also you will basically can control your blood sugar much better. When you have high sodium food, like for example, chips, food are really high sodium because of potato chips, cold cut, frozen meal. Those are actually increase the symptom, and that's just exaggerate your symptom of neuropathy, especially your sodiums go up, and actually it really screw up your kidney, and also restrict your blood flow in many, and plus jack up your blood pressure because of salt. Simple as that. Now, sugar snack, like for example, you should avoid sugar snack like donuts, whatever dessert you're having. On the end, sometimes you have ice cream, cookies, candy, or excess fruit. All that's have to control. Now, a lot of customers say, "Hey, I like ice cream." Well, fine. Once a month, instead of a scoop of ice cream, take 1/4 scoop. At least got the taste, got the feel, and be satisfied. In snack, instead of taking sugar in snack, take celery, take cucumber, chop it up a strip, and eat that, and you will be satisfied. So really, at the end of the day, you can able get alternative to help you to take off the snack. Well, try not to get fried food. Like for example, yeah, things like French fry and that stuff, and that will not be very good for you. Alcohol is very important because you drink a lot of alcohol, it's very cocktail, very sweet, and actually that will be all affect you in your item. And also trans fat like margarine, packed baked goods, fried food contain a lot of trans fat. So you need to look at every label of the food, whether they have a lot of trans fat, can we harm you in a sense. So those are so important. So now we talk about diet, we talk about exercise, weight control. Now you have the three key component. Plus, you continue to measure yourself, understand where you're at. So you need to have healthy replacement of those unhealthy food. And what is that healthy replacement? The food is rich in omega-3, like for example, fish, a lot of fish like salmon, cod, where they have DHA and that provide better brain health. So omega-3 source is so important. And you have to use plant oil, such as, you can do oils like olive oil instead of typical uh, oil that you folks are using, or butter. So these are things that you have to continue to get olive oil to cook. I now use all olive oil basically, and it's very, very good. Plus you got to eat a lot of vegetable, all green vegetable. Doesn't matter what type of green, but as long as green. And basically, all these green vegetables can have all the different vitamin and can improve, because of the vitamin, you get better immune system and enhance you for immunity. And also because this is plant-based diet, in a sense that you have lots of vegetable. So net result, you will also better control your carbs because vegetable has less carb. Okay, so net result, because of the vegetable, you also have a lot of fiber. It help you digest system. And also one more thing is very important, because these vegetables with all these fiber, they help you on bowel movement. I know many of you has basically have a lot of bowel movement issue. If they're diabetic, they tend to have hard time. They have to force themselves all the time. Well, if we eat a lot of vegetable, a lot of greens, a lot of salad, tend to help you there. So what would be is cabbage, lettuce. You can also lignum, tomato, whatever vegetable, asparagus. You get that, you take it with daily, lot vegetable. And I teach all our customers here now, and they stick to it. I think they all come out to be pretty good. Half bowl or half plate, everything is all greens, meaning it could be lettuce, could be cow with whatever vegetable you put in there, and 1/4 will be your protein, which is usually tofu, lean pork, fish, all that, and 1/4 will be the starch, but they don't eat white rice, they eat brown rice, red rice, or beans, and that result they get very good diet, a lot of variety, and you can get a lot of internet to tell you, okay, what can you eat to give me that achievement of the type of things that give me a lot of fiber, and net result that good diet, good recipe, and help them to continue to be a very lively, good living. Also, you need to have high fiber fruits. So after dinner, instead of eating cookies, or dessert with ice cream or very sweet, you take high fiber fruit. So some of the high fiber fruit can be, could be pears, but you don't want to get sweet fruit like mangoes. That will be very high sweet. So you gotta take food which have low glycemic index. Look it up at the website. Apple will be much better than eating an apple than eating a mango. So these again is a healthy fiber, and that will be extremely good. So also you can take other type of fruit, like I said, apple, pear, peach, berries. So for example, that will be another very good fruit to take. They might be not as sweet as you want to, but on the other hand, stay away those sweet fruit. Like for example, grapes is very sweet. Although a small little one, a lot of grapes are very sweet. Pineapple is also very sweet. Melon very sweet. So these might not be necessary a good fruit for it. So stay away from it. It will be better. Now, whole grain is really good because there's a lot of fiber, and this can help you on the brain. The carb is low, but again, there's a lot of low glycemic index. Plus, the fiber help you very good health, and some of the grain is like buckwheat, oats, barley. You can make barley soup, for example. Those are really good for your diet, for overall health, and reduce the risk for you for lower your blood sugar. Okay. And the last but not least, you got to drink low sugar tea. Remember, I said low sugar tea is really a good drink with 6 to 8 cups. You can actually lower your blood sugar, decrease your cholesterol, and decrease your blood pressure. And there's no caffeine. So you drink that, it is not going to affect your sleep, and it's good for your nerve. So remember, drink at least 8 glasses of low sugar tea per day. Very simple. You just put one bag of low sugar tea to a bottle, and that's already good for 4 cups of low sugar tea. And then another bottle, do the same thing, 1 bag and 4 cups already. So total, you get 8 cups. A lot of people buy 2 bottles, and they are usually 1 liter. Or if you don't get 1 liter, you get 800 ml. That's still good. So do that, and then you can drink, and then that result, you have at least 2 liter of low sugar tea instead of drinking water. Now you drink low sugar tea, keep driving your blood sugar down. That will be very good. So you drink low sugar tea, that result, you take care of your high blood pressure, and high bad cholesterol. So you are really now being taken care of yourself. The objective is lower your blood sugar, and then that result, your 3 high will be lower: blood sugar, cholesterol, and blood pressure. And your problem will be diabetic amyotrophy will be probably less problem for you. Now, don't forget, this issue is going to cause you pain, weakness of muscles, and then it will actually, especially a lower part of the body, if you don't take care of it, you might start losing your muscles, and you will start getting difficulty walking. And so you have to protect your nerve, adopting a lifestyle that you can get the best blood sugar level. That means that you have to lower your weight, take good care of your diet, meaning a low carb diet, and then take care of lower your 3 high, and continue to exercise. And you can be mainly walking 10,000 steps a day. If you can't get that, do a step master. Now, because if you can control your blood sugar through food, exercise, and your weight, all that will help you to improve, your better condition. And if you really do exercise and food and all these things, it give you a really good protection to your nerve. So focus on diet, especially you have to have good whole grain, lean protein, healthy fat, plenty of vegetable. All that will support your nerve and muscle health. And that's the today message. So important, you got to continue drive the blood sugar down, and through diet control, exercise, weight, and continue to measure, write it down, your blood sugar, how it goes. And if you can do all that, I'm very sure you'll have less chances for nerve damage, and you'll be very, very healthy and happy. Thank you very much for spending the time to listen to our webinar. If you have a question, write to me. I'm Andy, ANDY, at WAHFONG.com. Andy, ANDY, at WAHFONG.com. Or WhatsApp me. The number is 852-6792-8891. 852 country code 6792-8891. 852-6792-8891. So if you have any question, do write to me, because a lot of people do write, and I appreciate the share their problem. I'm very happy to help them. I'm looking forward to work with you. And I know all what I mentioned, it does take work. And it's okay. If you can have the desire to take work, the chance that you get sick is very little. So you will work on it, lower your blood sugar, lower your cholesterol, and lower blood pressure by controlling your diet, all greens, a lot of fish, a lot of beans, and some brown rice. And then you exercise 10,000 steps a day, and then lower your weight. Now, if you can do that, I'm very sure with you, you have less chance of your diabetic and all your different problems that come along. All right. Thank you very much. I hope that you're going to have a wonderful weekend. Take care. Thank you. Bye bye.